Nestled in northeast Kentucky, the town of Morehead built a reputation in the early 1900s around manufacturing jobs, educating the populace, and an overall community value built around hard work and diligence. However, one thing was missing. Citizens of Rowan County and Morehead lacked access to critical health care to meet their community's needs. In 1948, Dr. Claire Louise Cottle and nurse Susie Hableb set up a physician's practice in the town of Morehead. Dr. Cottle realized the importance of quality health care to this rural region and began a crusade to bring a hospital to Morehead. Dr. Adrian Doran, then president of Morehead State University, along with faculty from the university and a group of passionate citizens, helped forge the way for the hospital's construction. From day one, St. Clair and Morehead State have worked together to improve lives throughout the region. Dr. Cottle enlisted the support of the Sisters of Notre Dame, whose sponsorship was crucial to the success of the hospital. Not only did they help to secure the finances necessary to build the hospital, but they also provided the staff to manage day-to-day operations. Their continued support has been a blessing to St. Clair.
Since the inception, this institution and this health system and what it is today was built on the backs of incredibly brave and tenacious women. Dr. Claire Louise Cottle and nurse Susie Halbib and the Sisters of Notre Dame. And against great odds, those women came to this community and they were determined to better the environment of healthcare for the people of this region. And they didn't let any obstacles stop them. And the sisters still do that today. They evolve, they innovate, they create, and they conduct themselves to support the efforts in the people of this region.
Dr. Cottle didn't just want a hospital. She wanted a good hospital with good physicians. She turned to Dr. Warren Proudfoot, a professor at the University of Kentucky. St. Clair needed quality physicians, and Dr. Proudfoot needed a quality facility where his residents could train. It was a perfect match. While it has evolved over the years, the affiliation these two physicians worked to create in 1963 remains to this day. In July of 1963, the dream of a hospital became a reality. Named in honor of Dr. Claire Louise Cottle, St. Clair Medical Center opened its doors to Morehead, Rowan County, and the greater region of northeast Kentucky with 9 nurses and 6 physicians.
We started with the help of the University of Kentucky and their medical expertise. And so there was a vision for St. Clair that it would be more than just a small rural hospital. And I think the way that St. Clair has grown to meet the needs of people and to do its mission, which is showing God's goodness, God's care, God's compassion through a healing ministry to the people of Eastern Kentucky. I think St. Clair continues to do that with excellent, and its tagline, amazing medicine close to home.
St. Clair is not only providing subspecialists to this community, but also outreach into other communities. We are a referral center for hospitals in West Liberty, in Maysville, and in Mount Sterling for our own subspecialty care, whether it's urology or orthopedics or other surgical specialists.
St. Clair Healthcare for 60 years has provided to its service region access to healthcare, wellness, and opportunity. What started as an idea became the reality of a rural hospital 60 years ago has now become a healthcare provider that fully serves the needs of the people of northeastern Kentucky.
I think Dr. Cottle was amazing herself. And when we talk about her, my belief is that she is present, that her spirit, I think she continues to be someone who advocates for St. Clair and wishes it the best for it and for the people.
I have had the opportunity to take care of one family in 5 generations of that family. And I felt very honored to do that. In addition, I feel honored to now being able to teach the next generation of physicians to be and acquire the skills they need to be excellent clinicians, but also the care and compassion they need to be great family doctors.
I arrived in Morehead, Kentucky 7 months before the pandemic started. And I witnessed an amazing group of men and women and dedicated professionals and students and a community that rallied together to support the needs of critically ill patients. I saw courage like I've never seen in 40 years in my career. I saw people give service above self at a new level that I had never witnessed in my career. And I think that experience has also served as a catalyst for a can-do spirit and a can-do attitude amongst our medical staff and our employees.
Now, 60 years on, St. Clair Healthcare is not only the largest rural hospital in northeastern Kentucky, it's also the region's largest employer, with over 1,200 staff members and a medical staff that has grown to 278 physicians and advanced practice professionals. It operates primary care clinics in 5 counties, with construction beginning soon on a new clinic in Morgan County, a multi-specialty medical pavilion, home to many of St. Clair's more than 30 medical specialties, 2 urgent care centers, one in a newly constructed state-of-the-art facility just off I-64 in Morehead, and so much more. St. Clair is also building a robust research program to expand both clinical and academic research opportunities throughout the entire healthcare system, now and into the future.
It's an exciting time to be part of the ministry. It's transformational for us. We are in the midst of evaluating strategically the replacement of the current St. Clair Hospital and building out a new regional complex that provides the latest and state-of-the-art technologies and services. In Morgan County, we are investing $11 million over the next 3 years to develop a comprehensive medical clinic that will serve not only the clinical needs of that population, but will also serve as a hub to introduce new physicians in training and nurses and therapists and many others allied health professionals to the people of that community. So in addition to the education collaboration that this institution has been notorious for, we also have developed clinical integration and affiliations with a number of institutions. The University of Kentucky has been there with us since the development of specialty services at this institution. We recently developed new relationships around orthopedics and sports medicine with Marshall University. Morehead State University has always been integral to the development of our nursing and allied health professionals. And recently, we developed a multitude of programming around clinical and non-clinical services with the Maysville Community Technical College. And we can't forget the investments that the Kentucky College of Osteopathic Medicine and our partners at the University of Pikeville have made in helping us educate and train the next generation of physicians. So collectively and collaboratively, those institutions have been integral to the development over the last 60 years of this health system.
Without a light, nothing can grow. A light was shined upon Morehead, Kentucky in July of 1963 when the doors first opened for St. Clair Hospital. This light has continued to burn bright and continues to grow brighter year by year. What all started as an idea to help a rural community that was desperately in need of access to health care became a reality and continues to grow and improve the health and livelihood of all those it serves.
I don't think that you can isolate this little town because it is a little country place. Every place in the world was country for that place at a time And I believe that as history has progressed, we have progressed. Our university is better. Our hospital is better. Our people are better educated. And life is better. We're just more pleased with what goes on in the world.